Effective Strategies to Prevent and Manage Burnout in Nursing Care. Presented by Sharifa Poku, Dafrozen Suya, Tintin Zoom, Zobeda Yazian, Shamika Malcolm and Fatumat Jinkine. What is burnout? Burnout is observed as emotional, psychological, and physical fatigue which results in disillusionment, detachment, cynicism, weariness, incredulity of abilities and skills necessary to perform efficiently. Low burnout is work physical and psychological resistance against stress-related factors. The ability to work under pressure. High levels of burnout and depersonalization, a disorder marked by periods of feeling disconnected or detached from one's body and thoughts, and low levels of personal achievement, affects the quality of medical performance, interaction with the patient, and the quality of life of the healthcare provider. Burnout can occur at all stages of career development and evolves over time, which is why this is a problem that requires early detection and intervention. Why is burnout a problem? Continued. Burnout is an important nursing concern as it results in low quality patient care, poor patient outcome, increased medication errors and near misses, absenteeism and high turnover rates, hospital-acquired infections, type, substance abuse and misuse and other poor coping skills, ineffective intra and inter professional communication, personal predictors of burnout, high achieving type A personality, high levels of extroversion and neuroticism, sex/gender, age, marital status, number of children, years or professional experience, number of roles and positions held by the individual, history of insomnia, depression, chronic diseases, the use of anti-anxiety medications, intimate partner violence or issues. Environmental predictors of burnout. Work-related environmental factors. Lack of resources. Lack of autonomy. High stress working conditions. Increased workload. Long hours worked per week. Lack of social support. Poor conflict resolution skills. Lack of individual self-awareness and emotional intelligence. Type of unit. ICU, surgery, short stay, emergency, etc. Relationships with colleagues or superiors, i.e., bullying, leadership styles. Consequences of burnout: lack of professionalism and accountability, decreased quality of work, increased amount of errors, possible substance abuse, depression, or suicide, if ignored, leads to moral distress, compassion fatigue, and symptoms of post-stress disorder, PTSD. Important points to consider. Note: it is important to be able to identify risk factors for burnout. There is no one approach that fits all situations to prevent and manage burnout. Multiple strategies and tools are required to respond to the individual and organizational risk factors, including raising awareness and promoting potential strategies to address burnout, assessing the current situation, and resources available to combat burnout. Ineffective coping strategies as a result of nursing. Inability to effectively cope with work-related stressors can result poor management strategies such as investing more effort to build relationships within an interprofessional practice, alcohol/substance abuse, quitting the job leading to increased turnover, absenteeism, depression/suicide, lower emotional intelligence. Our Change Initiative. Fostering a culture of change to prevent burnout. In effort to further the fight against burnout, we have developed a Burnout Prevention Initiative, BPI. Our initiative is to change unit culture to reduce nursing burnout through creating awareness, empowering nurses, and building resilience through strength-based approaches and positive deviance. This initiative will be shared through a social media platform. Our Change Initiative. Fostering a culture change to reduce burnout. Change Initiative steps. Recognition, recognizing and honoring efforts and achievements of nurses. Establishing a skills sharing platform to empower nurses to support each other. Creating a safe space for sharing and opening up burnout issues. Promoting healthy coping strategies. Through this approach, we will foster a change of culture in nursing that facilitates the empowerment of nurses to address underlying issues such as lack of recognition, thereby significantly reducing burnout in nurses. Causing change through Burnout Prevention Initiative, BPI. Promoting staff awareness to prevent and manage burnout in nursing. Provides platform to encourage dialogue about burnout. Empowers staff to create and maintain supportive networks. Promote peer-to-peer recognition for modeling organizational core values. Encourage, recognize and reward ethical organizational behaviors. Mobilize all available resources to combat staff burnout. The process of implementation. The following slides consists of the detailed steps necessary to implement our initiative of preventing burnout through culture change. The model we chose is Cotter's 8 Stages of Change. Cotter's 8 Stages of Change. Create a sense of urgency. Form a coalition. Create a vision. Communicate the vision. Empower others by removing barriers. Create and reward short-term wins. Consolidate, reassess, and adjust. Reinforce the changes. Sense of urgency to cause change in addressing nursing burnout. Burnout is endemic and costly to the healthcare system due to poor job satisfaction and performance, absenteeism, higher turnover rates, and adverse patient outcomes. Findings of large government study showed that nurses' illness-related absenteeism was 58% higher than the general labor force, Lashinger et al., 2013. There is a sense of urgency to identify risk factors to prevent nursing burnout at a unit or institutional level. Identify positive deviance and form a coalition. Identify staff members with strong coping skills and resilience in dealing with workplace adversity. Respect and trust of their peers. Willingness to champion the Burnout Prevention Initiative, BPI. Strong followers demonstrate staff buy-in into the leader's vision. Effective communication skills who will encourage dialogue. Articulate the short and long-term benefits of preventing burnout. This coalition can include students, staff RNs, allied health team members. Create a vision. Set a clear vision using the SMART criteria. Specific goals to enable staff to recognize signs of burnout and to prevent burnout through staff support, recognition, and awareness through Burnout Prevention Initiative, BPI. Measurable. Aim is to measure overall staff engagement, self-reported job satisfaction, via surveys, decreased rates of turnover, lower adverse patient safety events, i.e. medication errors, decreased number of sick days over a 3-month period. Achievable. Data collection and analysis over 3 months to determine the effectiveness of the interventions. Relevance. To promote positive staff and patient health outcomes, safety and well-being, efficient use of institutional resources, and decreased healthcare costs. Time-bound, 3-month period to initiate intervention on a particular unit. Communicate the vision. Communicate the goal of prevention of burnout through sharing platforms and staff recognition. Posters, flyers, and pamphlets. Open discussions about burnout during safety huddles, prior to rounds, open forums, unanimous comments boxes, and online platform. Encourage honesty in discussions about burnout. Foster the development of self-awareness. Promote evidence-based interventions to decrease burnout and increase resilience among staff. Empower others by removing barriers. Communicate that burnout is not a sign of weakness or failure to reduce stigma. Recognize positive deviance with strong coping skills. Empower and encourage all staff to seek help, support one another and offer support to those who seek help. Recognize and promote positive teamwork, leadership and supportive behaviors on the unit to encourage others to act to foster a collegial and friendly work environment. Create and reward short-term wins. Empower staff to recognize one another for demonstrating caring behaviors. Empower staff to nominate their colleagues for going above and beyond the call of duty, i.e. Shining Star Staff Recognition Program. Recognize nominated staff on staff recognition, kudos, boards in the break room or other common areas. Reward increased staff performance and positive patient outcomes with treats such as coffee and donuts and informal outings for meeting specific milestones such as a 50% reduction in calories or 80% reduction in medication errors due to the BPI. Consolidate, reassess, adjust. Provide timely feedback on the progress of the BPIs. Clearly articulate what is working and areas of improvement for the BPIs. Share milestones achieved and continue to encourage staff buy-in and make the BPIs part of the organizational policy and culture. Authentic leadership styles that displays a pattern of transparent and ethical leadership with emphasis on openness to sharing information. And receiving feedbacking is key to this process. Strategies used by critical care nurses. A 2018 Canadian study that investigated burnout and resilience among critical care nurses found that resilient nurses commonly used four main techniques to avoid burnout: protecting, disengaging, depersonalizing, humor and asking for help, processing, rationalizing, reflection, and informal debriefing with colleagues, decontaminating, fostering supportive relationships in/outside of work, distancing, purposeful planning to be away. A systematic review of stress management strategies for nurses suggests that mindfulness education programs can decrease burnout by reducing the nurse's perception of stressful situations. Effective communication skills training can lead to decrease in emotional exhaustion. Strategies nurse leaders can use to promote resilience. Create opportunities for social connections. Encourage and model positivity through gratitude and acts of kindness. Apply a strengths-based approach when assigning duties. Provide mentorship to nurture personal/professional growth. Encourage self-care without shame/guilt. Facilitate mindfulness, i.e. journaling, deep breathing, and listening to music. Acknowledge hard work through meaningful recognition. Strategies to promote resilience among individual nurses, teams, nurse leaders, organization as whole, nursing students. Strategies to promote resilience in nurse individuals. Selecting and eating healthy foods. Practicing gratitude daily. Getting a good night's sleep. Practice mindfulness. Practicing self-reflection. Learning and developing new skills. Creating healthy social networks at work, outside of work. Practicing cognitive reframing. Balancing schedules and commitments through prioritization. Strategies to promote resilience in teams. Providing positive coping and stress management workshops. Fostering healthy and supportive working relationships. Creating an aligned vision/values. Providing moral/ethical support. Valuing individual effort through recognition. Encouraging a culture of positivity and gratitude. Providing emotional intelligence training. Creating a supportive work environment. Diplomacy. Honesty. Accessibility. Learning. Positive role modeling. Strategies to promote resilience in nurse leaders. Facilitating self-awareness/self-care. Promoting transformational leadership. Sharing individual purpose and core values. Role modeling resilience competency. Creating a culture of coaching. Creating a psychologically safe environment for learning and decompression. Strategies to promote resilience within an organization. Ensuring clear roles and realistic expectations. Modeling gratitude. Incorporating reflective practices across the organization. Promoting a culture of learning and knowledge sharing. Aligning nursing work to mission, vision, goals and values of the organization. changing organizational narratives through cognitive reframing, practicing a culture of accountability and control, strategies to promote resilience in nursing students, ensuring access to learning resources and support, teaching decompression techniques, reframing negative experience into positive, providing education relating to stress and resilience building strategies, encouraging reflective practices, providing appropriate guidance and feedback, promoting peer coaching, role modeling health and self-care. Benefits of developing nursing resilience to overcome burnout. Personal benefits, increased job satisfaction, increased nurses' excitement and work engagement, increased patient safety by reducing medication errors, false, hospital-acquired infections, high, and overall patient mortality, improves nursing retention, improves nurses' performance, promotes nurses' social connection, develop relationships among nurses from different units. Personal benefits continued. Increased self-awareness, enhanced kindness toward patients and co-workers, increased self-confidence, enhanced learning process and self-growth, improved nurses' self-care, like regular exercise, getting adequate sleep, eating a balanced diet, and practice meditation/deep breathing, improves nurses' listening and effective communication abilities. Professional benefits. Decreases horizontal and vertical conflicts, improves nurses' performance, improves/increased communication skills, increased teamwork in the unit, improves nurses' creativity at work, encourage nurses to seek new position in the unit and professional growth. Organizational benefits. Maintaining and decrease healthcare organization financial health, increase patient care quality, increase patient satisfaction, reduce staff turnover and shortage of nurses in organization, improve quality of care in the organization, improves healthy working environment, such as boosting morale of the unit, increase positive interpersonal and intrapersonal relationships, increase positive impacts, outcomes in healthcare. Follow us on our Instagram page, informing our followers everywhere in the world about the importance of nursing burnout through the use of social media. We have everything from fun facts, useful tips, engaging polls, as well as real-life scenarios to educate and involve in order to make a difference and let others know that they are not alone. In just 2 weeks, we've had over 254 interactions, 1,472 impressions, and 165 followers. Our Instagram page address is https://www.instagram.com/nursing_burnout_awareness. These are just some of the many responses from our followers. When the question was asked, what are some things you do to prevent burnout? The response was, I use proper techniques when ambulating clients during shifts. When the question was asked, do you take time out of the day for yourself? The response was, 78% answered yes and 22% answered no. When the question was asked, what are some things you do to prevent burnout? The response was, I love to relax and have a me day by meditating, yoga and exercise. When the question was asked, what are some other ways to address and prevent nurse burnout? The response was, huddles for staff to share workplace concerns. Additional response was, create a safe and relaxing space where nurses can take proper breaks during their shift.